Let's go to the adjuvant chemotherapy, where we stand after all these years of long research and clinical trials. When we look, there are trials done where, so basically the standard of care has been, as I said before, radiation therapy. So everybody in stage 1 to 4 disease was receiving radiation therapy. Then we started discussing, can we add chemotherapy on radiation therapy and get benefit? We did different trials. These are starting from the very beginning, the trials to the very end. And we could not really see a real benefit of addition of chemotherapy except in the last two trials on the right side, the Nordic trial and the Dutch trial, where we start seeing that addition of chemotherapy to radiation therapy was beneficial. There were less patients who were getting local or distant relapses. Probably there was also some benefit in overall survival. So it looked like that chemotherapy was benefiting. But we also know that radiation therapy is not helping us to improve survival. So why to give radiation therapy? But we didn't had such trials at that time. So we started doing trials where we tried to omit radiation therapy, typically radiation therapy versus chemotherapy. We could not see that any of these trials were better than the other. There are quite a few problems with these old trial designs, especially I can take the last one on the right side, which was done just 10 years ago, presented just 10 years ago. Uh, when you are doing a trial, you have to pick the right population. If you pick a population which has a very good prognosis without doing anything, then you will not be able to show the benefit of the intervention. So here, for example, half of the patients were grade 1 and grade 2, stage 1B, which is quite good prognosis patients. And you cannot improve or hardly improve the outcome of patients who have 5-year survival of 90%. It's difficult to go and make a difference. So that's something we have to keep on, and that's why we saw the people starting to do the trials where they really took the high risk populations. Here, Daniela Mattei presented the data of a trial where the standard of care treatment, which was chemotherapy given together with radiation therapy plus adjuvant therapy with chemo. So you are giving chemo with radiation therapy and after chemo. That was compared to no radiation, just chemotherapy, and they didn't show any difference in overall survival. The patients who had radiation therapy on top of chemotherapy had more complications. So that was a very eye-opener to see that you actually do not need to overtreat the patients with addition of radiation therapy. You can give chemotherapy alone and get a good outcome out of that. So these are the era of treatment when we were trying to get maximum benefit of the available treatments. What was that? That was radiation therapy and chemotherapy. That has changed.